Access to healthcare is a test of a society's values.
In terms of our health, we're experiencing very high degrees of invisibility and exclusion and marginalisation and discrimination and misinformation.
4% of our respondents were told that they were not at risk of STIs by their healthcare worker, which is simply not true.
Lesbian and bisexual women are twice as likely to have never had a cervical smear test compared to women in general.
Older LGBT people often have their health needs overlooked in all sorts of ways, but most particularly in mental health.
You expect the service provider, the health service professional, to engage with you about your sexuality. There are all sorts of things that she might need to ask you.
1 in 6 lesbian, gay and bisexual people over 55 are not confident that their GP and other health services would be able to understand and meet their needs.
The trans communities really do have a very large set of needs around health.
We know people who've been laughed at by their GP, and GPs can be very dismissive and refuse to refer people on.
1 in 4 gay and bisexual men have never been tested for sexually transmitted infections.
They need to recognise the needs of LGBT people, but especially in my field, gay men, as being far beyond just HIV. Gay men do not equal HIV.
The lack of sexual orientation monitoring by health services means there remains a distinct lack of information, as opposed to supposition, about the health and social care needs of LGBT people.
So you can't gloss over this anymore. This is something you have to deal with, and this is something you have to fund.
Collecting robust data is the first step, a firm foundation on which the new public health system can improve the services it offers LGBT people.
There will be opportunity for funding new services. We have to be in there fighting for LGBT services, shouting about the evidence need.
If we're going to be treated holistically, we need to come out. But you're not going to do that until you feel safe to do so.
But it's time for the NHS, the new commissioning boards, Public Health England and all the new statutory bodies created by the Health and Social Care Bill to publish their own plans as to how they intend to commission services especially designed for LGBT people.
It's the service provider's responsibility to enable them to declare their sexuality.
Every local authority will have to establish a health and wellbeing board. They will be responsible for conducting health joint strategic needs assessments. We need to be making sure that LGBT health concerns are in every single one of those joint strategic needs assessments.
We're serious when we say we want to reduce health inequalities, and the challenge to the Commission is how do you commission in a way that actually delivers those outcomes? And the only way you're going to do that is by working in partnership with LGBT communities, because I can tell you we don't have the answers up in the department. I'm sure you don't just at your desk. You need to work directly with communities to achieve our shared goals.
I want to see things happen and change in my lifetime, and I think you guys want to see things happen and change in your lifetime as well.
Let's make sure wherever an LGBT or trans person is, they are receiving the best done health service that they could ever want.